Campral tablets is used along with counseling and support to help people who are alcohol dependent not drink alcohol. Acamprosate works by restoring the natural balance of chemical in the brain, neurotransmitters. Before starting this medication, you should no longer be drinking alcohol. Acamprosate has not been shown to work well if you are still drinking alcohol when you start taking it. Indications. Campral is indicated for the maintenance of abstinence from alcohol in patients with alcohol dependence who are abstinent at treatment initiation. Treatment with Campral should be part of a comprehensive management program that includes psychosocial support. The efficacy of Campral in promoting abstinence have not been demonstrated in subjects who have not undergone detoxification and not achieved alcohol abstinence prior to beginning Campral treatment. The efficacy of Campral in promoting abstinence from alcohol in polysubstances abuses has not been adequately assessed. Dosage and administration. The recommended dose of Campral is 2 333 mg tablets. Each dose shall total 666 mg times daily. A lower dose may be effective in some patients. Although dosing may be done without regard to meals. Dosing with meals was employed during clinical trials and is suggested in those patients who regularly eat 3 meals daily. Treatment with Campral should be initiated as soon as possible after the period of alcohol withdrawal when the patient has achieved abstinence and should be maintained if the patient relapses. Campral should be used as part of a comprehensive psychosocial treatment program. Dosage in renal impairment. For patients with moderate renal impairment, a starting dose of 1 333 mg tablet taken 3 times daily is recommended. Campral is contraindicated in patients with severe renal impairment. Contraindications. Hypersensitivity to acamprosate calcium. Campral is contraindicated in patients who previously have exhibited hypersensitivity to acamprosate calcium or to any of its components. Campral is contraindicated in patients with severe renal impairment. Drug interactions. Acamprosate does not affect the pharmacokinetics of alcohol. The pharmacokinetics of acamprosate are not affected by alcohol, diazepam, or disulfiram, and clinically important interactions between naltrexone and acamprosate were not observed. What are side effects of Campral? Side effects of Campral include severe anxiety, depression, mood or behavioral changes, suicidal thoughts, swelling in your hands or feet, pounding heartbeats and fluttering in your chest.